Today we're joined by Nick Strasser. Nick is a fellowship trained foot and ankle orthopedic surgeon. He did his fellowship at Ortho Carolina. After that, he spent a few years in private practice out in the Northwest in Oregon. And then a couple of years ago, he took a job as a assistant professor of orthopedics at Vanderbilt in Nashville, Tennessee. Welcome, Nick.
Yeah, it's good to be here, Stu.
Yeah, well, I appreciate you coming on. So, you were in private practice for a few years and you were a general orthopod, correct?
Yeah, I was in private practice and I was working I was doing foot and ankle. I was probably 75-25
Okay.
foot and ankle, and then the rest was the rest of lower extremity.
Okay. And then, so what kind of brought you from being in private practice to wanting to join, a teaching institution at a major place like Vanderbilt?
Yeah, it's a good question. The draw for me was first off, I was extremely, we were very happy where we were. So if you would tell me from 5 years ago that I would be here, I would have said you're crazy. Um, I think what came up is one is it was an opportunity, I think, to be involved in teaching, working with residents. We get to work pretty closely with them, and I kind of always had that kind of tug to be involved in that role. And I thought that the thing that was so cool about private practice is I got so much experience managing a lot of different lower extremity injuries and surgeries, and it felt like I learned a lot that I could pass on. I think also I was looking at some professional growth opportunities, and I felt that being in a little larger population, Nashville certainly growing a lot, and it gave me an opportunity to kind of expand more into the foot and ankle world and maybe a little bit less away from some of the more general orthopedics. So that was the motivation. Nashville came up just kind of at the right time in terms of the job at Vanderbilt, and so we moved here just about 2 years ago, I guess, coming up in August with the whole crew, and it's been good. It's been a transition in terms of learning how to function in a different system, but it's been a good journey.
Yeah. Well, change is never, it's always hard, but actually once you get into it, it's a lot of times not as bad as we had anticipated.
Yeah, it's interesting. It might depend on the day that you ask me on how I feel about it.
Right.
It is really hard to change practice. That is, I don't know how people who do it several times over the course of a career do it, but it is really hard because you
Yeah.
develop a lot of equity with the community, whether it's the medical community and the patients that are there, and you have to rebuild that. And people don't know who you are. They do know the name, the Vanderbilt name, and sometimes that's good, and sometimes that has some negative connotations. But for the most part, I think is a positive. And but it does take time to build that rapport within the community.
Yeah. Well, kind of the main thing that I want to talk to you about today is I've had the privilege of watching two of your webinar series that you put on a monthly basis with, uh, I'm going to butcher his name, with
Jan Szatkowski.
Jan Szatkowski. Thank you.
Took me 4 years of residency to learn how to say it, so I finally
Well,
got it.
I'm glad about a month or so for me. It has not been 4 years yet. But anyway, I know you two are doing this and have done it for a little while. Kind of tell us, what was the motivation behind doing this? And it's
Well,
it's 4 reps, correct?
yeah, the motivation was it seemed like there was a need, and the way that it came to my attention was I was probably at a spot where I was looking for things to do on the side as I was making this transition, and I had somebody a rep reach out on LinkedIn asking if he could be part of our pre-op conferences. We have them every week. It's not something I did in private practice, but it's something we do with
Mhm.
our residents and with my partner here. And then we go through and talk about tough cases coming up, and it was I got a lot out of it because I would learn as I would ask questions back and forth about how do you do a certain technique. And the rep reached out and asked if they could join us for that. And unfortunately, with like HIPAA and things like that, it's a little bit hard to do to have them join. But it got me thinking that that would be actually a really interesting thing for a rep to listen in on, to us talking back and forth on how to do the case. And then, there's always, it's one thing for us to list the case, but it's another thing for the rep to understand what we're trying to do and communicate. And some of us are better communicators than others in terms of what we're going to need and what our steps are going to be. But the thought process being that if we could have this, it may be an opportunity for them to further their education about the cases that we're doing, how to prep for them, and how to kind of think through the different steps that are coming on. And the idea being that if you can get to that level where you're a couple steps ahead and you have a backup, or you have something in your car or that you brought in just in case something happened, you would be light years ahead of things. And I think that's just going to create a favorable environment for that rep to shine in those surgeries.
Yeah, no, absolutely. I mean, as a rep for my whole career, always having a backup plan is
Yeah.
invaluable to the whole team, obviously.
Yeah.
And I think that what you guys are doing is is great from the standpoint of every rep is trained to a certain extent from the company or companies that they work with. However, those are strongly biased as to
Correct.
why their product is superior.
Yeah.
And I think having the unbiased, you know, learning opportunity, and obviously you and Jan are biased in your own ways,
Correct.
but it's not product bias, which is the most valuable thing I think for the reps to understand. So I
Yeah.
see a huge need for it.
Yeah, I totally agree. And even just as a surgeon going to some of the different education, I learn a ton when I get an opportunity to go there and hear how different people approach things. But you always have that lens on a little bit of, okay, is what they're telling me because they're being told they need to tell them that teach this, or is that actually the right way to do it? And so that was the goal, is we're not like opposed to industry and instruction, but we're really trying to get to what are we doing, why are we doing it, and what's the goal. And I think that just helps hopefully clarify that as you learn from your own company, you understand, hey, this is how we approach this problem, this is the tools that we have, and maybe I have another tool that I hadn't really thought about that I can use in this situation as well, or as a backup if you got into a tough situation.
Yeah. And even to go a step further with that, I know with looking back at my training, especially early on in my career, is surgeons would come into our training and teach us about it, which is very appropriate as well. Although obviously they were coming in because they believed in the product and the way that they were doing it and the way the company was doing it, which then kind of continues that path down. I'll just say drinking the Kool-Aid or being company brainwashed is like, look, this is the way it's done. And so again, that is extremely valuable what you are trying to accomplish, because if you can take a step back, understand that you know, there's a lot of different ways or different usages of different companies' products to get that same end result, then everybody's going to be better off understanding that.
Yeah, I think the having the backup plan is so critical. And I think the best reps that I've had an opportunity to work with have been the ones that have repped other companies in a pinch. You get
Mhm.
into a case and there's there's a hole in something, or there's a size. I mean, all sorts of scenarios can come up, and they've stepped in and said, hey, I know, brand X is here, I can open that for you, and they'll kind of take care of it on the back end. And I know that in the moment the short term gain is not much for
Right.
doing that, but in the realm of saying that surgeon now having this gone through a situation kind of into battle with that rep, and the rep help
Mhm.
them out in that case, is it goes miles. And I think I'm more willing in that scenario to continue to come back and work with them, and and use their product again when I know that they kind of stepped in even though they weren't seeing a secondary gain.
Right. So let's just get back to the webinars for a sec. Like, who in your ideal situation, who are these currently geared towards?
So they're definitely geared towards those who are working in medical sales, and partially because I just don't think there's anything else quite like that out there.
Right.
Um, and they're geared towards those who are, I think, are trying to learn that kind of level of mastery to understanding what the surgery is, what the goal is. And we're trying to break it down into some of the basics so that they can look at an x-ray or a CT scan, recognize the things that we are looking at, and then saying, okay, now I can almost generate a somewhat of a plan and have kind of an idea of the things you're going to need for this case. And so that's really the who we're trying to generate it for. I think there's been some other surgeons that have jumped on, that have listened in, but kind of getting those little extra tips and tricks that we've done and used, and be able to kind of take them back to their surgeons. And if I got a message after our most recent one, and I had mentioned a particular tool we use for contouring the back of the calcaneus. And one of the reps sent me a message and said, "Thanks for the tip. I showed it to my surgeon. He used it on the case. He loved it." And then
Yeah.
those are the kinds of things that I want to hear from it. That hey, I showed this to X, Y, and Z, and they liked it, and it just builds that rapport and builds that kind of level of mastery.
So you didn't get one saying, "Hey, I showed it to my customer and he thought you were an idiot" type
I'm
message?
sure they haven't sent me that
They
message
haven't sent you
yet,
that one
but
yet. Yeah. Yeah.
I usually
So
blame Jan if that's the case.
that's actually a good thing since he's not on here to defend himself. Um, but it sounds like this is really, it is for experience as well as inexperience, because what I have found over my career is I can learn from any type of learning environment, whether it's basic or advanced. It's all about finding what is a fit for the people that are my customers. And you know this as a surgeon, is that every surgeon thinks differently. So I think giving the reps this broad experience with you and with yourself and Jan is again invaluable to them.
Yeah, and I think within, the interesting thing is in foot and ankle, it's grown so much, and that's part of the reason we started there. But it's grown so much. There's such a breadth of procedures that we do, from trauma to reconstruction to sports, that there's a lot of things to cover and to understand. And so I think, having kind of that, trying to build a library of discussion so that you can go back, and if you
Mhm.
have that case coming up, you can go back and listen to our discussion on an insertional Achilles, with a double row technique, and you can kind of understand what we're trying to do as you prep for that case. And so what I've been doing is recording the discussions and then breaking them down into smaller bite-sized segments that you can grab on YouTube. And then what I'm doing is adding in some of the tools that we use, so that you can go look on the website at some of the different products, and it may not be your product, but then you at least understand, hey, what are we using for that, and
Mhm.
and what do I have that's similar, that I can show to my surgeon.
Right. But as you mentioned before, I mean, a lot of times, even us as industry reps going to the surgeon and say, "Hey, this is the trick I saw. I have nothing to do with this product, but it's something that you may want to take a look at," is a great way to build credibility
Correct.
and trust with
Yeah.
our customer base.
Yeah.
So, how long have you guys been doing this?
We started in October of last year. We've
Okay.
tried to, our goal is to get one a month, in terms of one about an hour session, and then record it. And we're doing it case based.
Mhm.
And we've tried couple different formats. We had one where we brought a guest surgeon and kind of gave a lecture on minimally invasive bunions, which was really helpful. But I think the case base we like, because then we can go through it kind of step by step. And then that way, if you have a case come up, hopefully we can build up a big enough library that you can go back, look at, reference, and then get yourself familiar, particularly if it's something you don't do that often.
Yeah. Well, I'll kind of ask you this last question in closing: is where do you see this progressing? If you and Jan are satisfied with how things are going, 2 years from now, what are you hoping this looks like?
I mean, I think the natural evolution would be to expand into things like trauma, total joints, hand, spine, other areas in orthopedics. Um, and I think if we can kind of figure out what is most beneficial, particularly for those in medical sales, and both those who are extremely seasoned and those who are very new to it. But if we can kind of figure out, what the right amount of content and that kind of
Mhm.
stuff, then I think expanding it to some other lines of orthopedics would probably be the next step.
Yeah. Well, I do know you don't have a shortage of content possibilities within the foot and ankle with all the different procedures that are going on. So so
Yeah, there is
maybe
a lot.
yes, so it may be a while before you expand out. But I love that vision that you have for the future and expanding and educating. If there are people within the industry or either other surgeons wanting to get a hold of you, what is the best way to do that?
Yeah, I'm on LinkedIn, so that's a pretty easy way to reach out. You can always send me a message on through LinkedIn. And then my email is nickstrasser@gmail.com. Feel free to send me an email and we can chat and would be more than happy to.
Well, Nick, I appreciate your time and I really love the heart behind what you guys are doing, trying to educate reps uh, to help them serve their customers better. I think it's a great cause. Selfishly, me being a rep, I really appreciate that.
Well, I appreciate having me on your channel, and it was great chatting.
Absolutely. Have a great day. Thanks, Nick.
Thank you. Bye.
Bye.